Hello everyone, and welcome back to our YouTube channel. Today we are doing another installment of The Mother Load. I'm Cora, and I want to talk a little bit about 5 common issues that a lot of pregnant women experience during the early, mid, late, or throughout the entirety of their pregnancies. Now, please note the tips that I offer here, always confirm with your primary healthcare provider to make sure you know what's best and what's right for you. I, as a pelvic floor physiotherapist, I'm just going to give you my 2 cents as well. So let's get started. The first and probably most common symptom that a lot of pregnant women will experience is nausea or morning sickness. This often happens because hormones are fluctuating, especially estrogens going off the deep end, and everything is just going up and down, and the way we interact with food during pregnancy changes quite a bit. So this can happen all day, not just the morning, and it can happen primarily in the first trimester, usually easing off a little bit in the second trimester. However, everyone is a little bit different. Some people might continue to experience morning sickness throughout. So what can we do about it? Well, first and foremost, my favorite recommendation is spearmint tea. Spearmint tea, I always recommend organic. Spearmint tea is very soothing to the tummy, helps to calm things down, and is highly beneficial when consumed during a meal. So if you're having your meal, have some sips of spearmint tea throughout. It can be quite helpful for morning sickness. Additionally, make sure your meals are of a perfect diet. Everyone's perfect diet is a little bit different. So make sure you know your body and you kind of relate to your body in a way that you know what serves you best. Talk to your healthcare provider, your midwife, or your doctor if you have any specific dietary questions or recommendations. I also recommend eating smaller meals because sometimes when we eat a lot all at once, the body gets quite overwhelmed. So smaller meals throughout the day might be a little bit more manageable. You can keep it down. And again, keeping that spearmint tea handy. In severe cases, I do also recommend speaking with your healthcare provider about any medications that might be helpful. If we're really, really sick throughout pregnancy, that can actually be not so safe. So we want to make sure that we are still keeping the nutrients that we need to feed and support baby, but we want to make sure that we're doing it safely. So talk to your midwife and doctor about what medications might be helpful. The second most common issue that tends to happen during pregnancy, kind of going along the same lines, is constipation and bloating. This one is brutal, okay? So typically, throughout pregnancy, we have a hormone known as progesterone that tends to slow down GI motility or gastrointestinal motility, meaning it makes your colon a little bit more sleepy and sluggish, leaving food in there a little bit longer so that more nutrients can be absorbed by the body that can then be transferred to baby. However, this is less fun to experience, so it means that we're more likely in pregnancy to experience harder stool, less frequent bowel movements, more need to push and strain during a bowel movement. As your pelvic floor physiotherapist, I do not recommend pushing and straining throughout a bowel movement. Instead, I recommend giving yourself a little bit more time on the toilet. Don't rush. If things aren't moving, if you're sitting on the toilet for 5 minutes or more, pop off the toilet, try again later. Drink plenty of water, at least 2 to 3 liters of fresh, clean water every day. Make sure you're taking in a good amount of healthy fibers. Now, this is different for everybody, so you kind of have to play around with what helps keep things moving. Talk to your midwife or your doctor about what fiber sources might be most beneficial for you. I also recommend walking. Daily walks can be very helpful for GI motility, at least 20 minutes. I personally love a good walk after a dinner, especially a big dinner, because then, you kind of wind down for the day. It's quite nice. If you're taking prenatal vitamins, or any prenatal vitamins, sometimes there's a higher iron content in there, and you want to maybe supplement that with some magnesium. I'm not 100% sure which magnesium is most beneficial for you, so this is a question for your midwife or your doctor to find out what might be helpful, because iron tends to bung us up a little bit more. Magnesium helps to keep things moving. So magnesium might be your friend. One thing that I have come to love Chia, flax, and psyllium, okay? This is a mixture of chia seeds, flax seeds, and psyllium, which is absolutely wonderful when you mix equal parts of all three. I was told by my homeopath to take 1 tablespoon in the morning, follow with a great amount of water, and then have my breakfast. So first thing in the morning, take this. Then at the end of the day, after you're done all your meals, right before going to bed, take another tablespoon, followed by a ton of water, and then go to sleep. This is something that you always want to follow with plenty of water, okay? Do not just take the seeds. You're not chewing them, you're not eating them, you're just putting them in your mouth and following with water. The texture is weird, but there's no flavor. And it is absolutely wonderful, okay? You want to feel better pretty quick. This is what I found to be the most beneficial. So chia, flax, and psyllium, by the way, helpful for people who are not pregnant as well. Also, if you're wanting a little bit of external support, you can come see a pelvic floor physiotherapist such as myself, who will show you certain massage techniques on the belly that can help keep the GI motility a little bit more favorable. And there's reflexology as well. Certain points on the feet can help stimulate gut mobility as well. Going along the same lines, the third challenge that a lot of women tend to experience during pregnancy are hemorrhoids. Hemorrhoids often happen because of constipation, because of poor digestion, because of increased pressure in the pelvic region, and because of bearing down or pushing too hard during a bowel movement. As baby gets bigger, these hemorrhoids tend to become worse, which is not fun. They can become painful. They can become quite tender. They can bleed. They can lead to skin tears and anal fissures, none of which are fun. So I did a little bit of research speaking to Leanna, our aromatherapist, and she gave me some wonderful advice in the form of essential oils that you can use topically right on the hemorrhoid. Now there's 1,000,001 different kind of formulas you can try. This one happens to be my favorite. The first oil from Young Living is cypress oil. Cypress, 1 or 2 drops in your palm, then 1 or 2 drops of geranium oil in your palm. And what I like to do is I like to use either a carrier oil with these oils, or I recommend to my clients that they use the Iris Vulva Moisturizer. Just a tiny little bit of this goes right on the skin mixed with the oils. So you put your essential oils in there, you put your vulva moisturizer or your carrier oils such as castor oil, coconut oil, or olive oil in your hand. You mix it all up, you place it directly on the hemorrhoid, and it is immediately soothing. And that hemorrhoid will slowly over time start to shrink, especially if you're also using your chia, flax, and psyllium, or your magnesium, or diet improvements, anything that helps to get GI motility a little bit more favorable for you. But these oils, I cannot say enough about them. Young Living has the highest quality seed to seal that I have seen. I have tried hundreds of different oils and different brands myself. Young Living is my personal favorite. The next challenge that tends to show up quite a bit during pregnancy is pelvic girdle pain. So this is defined as any kind of pain in the hips, pubic joint, SI joint at the very low back, tailbone, and I think we even consider chronic low back pain as part of pelvic girdle pain nowadays as well. So this can happen oftentimes because of hormonal changes. A hormone known as relaxin tends to soften all of our joints, making things a little bit more lax and loose and maybe a little bit less stable during pregnancy. Not that we're unsafe, not that we're at a level of we're going to pop our legs off any second now. It's more a matter of the joints are a little bit softer, more relaxed. They're not quite as tense and taut as they once were because we're making room for baby. We're getting the body ready for delivery. And this can sometimes cause the surrounding muscles to go into either a bit of a spasm or the ligaments to go into a little bit more of a sensitive phase, which can lead to pain. So what I highly recommend in this particular case is come see me, a pelvic floor physiotherapist, someone who can really kind of treat those areas very gently and appropriately for pregnancy. You can also try different taping techniques, which can be shown to you by a pelvic floor physiotherapist. There's acupuncture by a traditional Chinese medicine acupuncturist. There is also reflexology, which can be quite helpful. I also highly recommend, and I even said this, I think, in my last video, an app called Rost Moves Mamas. It is a wonderful, wonderful app because it shows you the do's and don'ts of various positionings and how to sit, how not to sit, how to sleep, how not to sleep. When we have that information, we can avoid provoking the pelvic girdle pain. So if we're sitting in a better position all day, such as with your knees apart, kind of using belly as a hammock for the baby, rather than crossing our legs and sitting in really tight closed knit positions, we can have a little bit more comfort at the pelvic girdle. I also recommend prenatal yoga. So we offer that here at Lumira, but you can go anywhere for prenatal yoga that you love. Prenatal yoga is a lovely way to maintain your flexibility without overdoing it, because we are already a little bit more flexible in pregnancy. We don't want to overdo it too much and therefore reef and pull on already lax joints. So we want a little bit of maintaining that stretch and flexibility while at the same time helping to build a little bit more stability and comfort in the pelvis. And last point I'm going to talk about today is difficulty sleeping. This is very common, again, because of hormonal changes. Honestly, in pregnancy, what isn't due to a hormonal change? So hormonal changes tend to mess with our sleep a little bit. Our sleep cycles kind of go up and down. We might feel very tired throughout the day. We might need to nap throughout the day. And honestly, that's the main fix. Nap when you feel you need to, when you can. Try to keep naps to about 20 to 30 minutes, so you're not totally interrupting your sleep cycle and your sleep hygiene. One thing that's very important as well is ensuring that when you're sleeping, you are maintaining good sleep hygiene. So you want a nice dark room. You want a room that is slightly cool so that you have a reason to use your blankets. You want a room that has no electronics. You want a room that doesn't have too many other distractions in it. So not a bedroom that has your office right there. You know, the bedroom should be designated for the bed and for sleeping. When you sleep, also make sure that your positioning is done well. So support your body with pillows, and you may need different numbers of pillows during your pregnancy. You might need more pillows towards the end when belly gets bigger and you need more support. There are specific pillows designed for this. However, I usually tell my clients, just go grab any kind of pillows that you like, place them wherever you need, whatever is comfortable for you, and have at it. Now, sleep position, sometimes there's a little bit of mixed information about that. Moms are often cautioned against sleeping on their backs or on their right side because there is the theory that baby can squish important blood vessels in the abdomen as baby gets bigger and can squish those blood vessels, causing mom to have significant issues. Now, even if you are absolutely dead asleep and those blood vessels are starting to get squished because somehow throughout your sleep you've wandered onto your right side, don't worry. Your body will wake you up naturally and have you turn just as it does now. When you're uncomfortable, when it's time to turn, that is totally normal and fine. The goal is to get a good sleep. Support yourself with pillows. Visit that app, Rost Moves Mamas. It gives you sleep tips as well. Try to catch those little naps throughout the day and make sure that you're also eating well in this case too. I personally find that sometimes when I have a very high protein or dark leafy green meal, not too big right at dinner time, but usually around late lunch, I will have a tendency to sleep much, much better throughout the evening. If I have a big heavy meal right before dinner or right before bed, I tend to feel very exhausted and my body is processing the food rather than focusing on getting some sleep. So maybe change where you have your heaviest meals in the day and see if that modifies your sleep a little bit. So that's all for me today. If you have any questions or any other tips you want to know about or any concerns, whatnot, feel free to leave me a comment below. Please like and subscribe to our channel for more content just like this, and we'll see you next time. Thanks. Bye.